GABA is actually synthesized from glutamate, right? And there's an enzyme called glutamate decarboxylase, and that's the only enzyme that actually forms it from glutamate and forms GABA, and it needs vitamin B6, and it also needs magnesium. These are the two important things that actually can raise the GABA neurotransmitter level. However, it's a very delicate dance that the brain does, because it's basically is producing the inhibitor from and the excitatory neurotransmitter, directly. And that's one of the interesting aspects of GABA, is that it has to perform a delicate dance with glutamate, although they always have to be in a balance.
Hello, welcome to the Smarter Not Harder podcast, your home for 1 cent solutions to $64,000 questions. I'm your host for this episode. My name is Dr. Scott Sherr, and I get to interview one of my good friends and mentors, Dr. Ted Achacoso. Dr. Ted really needs no introduction. He is an anti-aging physician. He has a tricontinental practice to people we can't talk about on these kinds of podcasts, and he is the founder and the pioneer of health optimization medicine and practice, as well as the chief daydreamer at Troscriptions. So today we talk about the GABA system in detail. What is GABA? Why we need GABA? Why people are deficient in GABA now, and some of the conditions and syndromes that are related to GABA deficiency. We also speak about how GABA is synthesized. We talk about various herbal and natural ways of increasing the GABA tone. We talk about consciousness. We talk about the generative model of consciousness, which is pretty cool. And we go and talk about also the health optimization medicine framework, the Troscriptions company, some secret ingredients that are coming out soon, and much more. That's all for now. Enjoy the show. Dr. Ted, it's good to see you.
Good to see you, Dr. Scott.
We get to be together.
Yes, and you flew in from Colorado.
You from DC. We're finishing up a conference here, and it's been great to hang out and bring our products to the masses. But this is a really exciting opportunity for you and I to discuss one of your new favorite topics, GABA.
Yes, it's an obsession. Here means Florida, by the way. Yes, I'm saying it's an obsession because it's one of the more neglected aspects of neurotransmitters. And this neglect is because most of the attention has been on what I call the superstar neurotransmitters,
right.
Dopamine, serotonin, acetylcholine, norepinephrine, opiates.
They're also sexy.
Cannabinoids, yeah.
But not as sexy as GABA as far as we're concerned, right?
Yeah, because it's about turning you off rather than turning you on. Although I can give you an example later of how turning you off can actually turn you on.
It's called parasympathetic tone, everybody. In the bedroom. Okay, that's just a foreshadowing for later. So let's talk about GABA, because I think most people have heard about it before. They probably don't know what the initials mean, nor do they know what it actually does. So let's chat with our audience about what is GABA and what does it do.
Yes, you can consider brain as having two main switches: on switch, which is mediated by the glutamate receptor, and an off switch, which is mediated by the GABA receptor. GABA is gamma-aminobutyric acid, right? If you have heard of the street drug GHB, then you have actually encountered, a metabolite of GABA. So, and these are like, if these are like wireless signals in your brain. One is an excitatory signal, and it's all over the brain, and the other one is a inhibitory signal. So they turn the signals on and off. So they are basically in the background. So you could consider it like this is the water in the aquarium, right? And then your fish are your superstar neurotransmitters, right?
And so GABA is not something that we can really take in directly. How is GABA formed in the brain?
Yeah, GABA is actually synthesized from glutamate, right? And there's an enzyme called glutamate decarboxylase, and that's the only enzyme that actually forms it from glutamate and forms GABA, and it needs vitamin B6, and it also needs magnesium. These are the two important things that actually can raise the GABA neurotransmitter level. However, it's a very delicate dance that the brain does, because it's basically is producing the inhibitor from the excitatory neurotransmitter, directly. And that's one of the interesting aspects of GABA, is that it has to perform a delicate dance with glutamate, although they always have to be in a balance, right? And this is one of the two that I know that form this kind of balance. The other one is, of course, dopamine and norepinephrine.
Right.
Dopamine comes from norepinephrine comes from dopamine, and that's also the delicate balance that's being done by the brain. Unlike dopamine and serotonin, they're from different synthetic pathways. So and that's what makes it really, really very interesting, and a central molecule to which I really have focused, because we live in such a hyper-stimulative world, and we can't seem to stop our minds from thinking.
Turning on the brakes, as you said to me a while ago.
Yeah.
When I was thinking about this after you gave your talk about a year ago now, turning off the brakes, or turning on the brakes, turning on the brakes. And what's interesting about both dopamine and glutamate is they both come from neurotransmitters, right?
Yes.
Come from amino acids.
Yes, they do.
Yeah.
They
Which
do.
amino acids do they come from?
Glutamate, of course, comes from glutamine, right?
Right.
And a simple way of remembering this is, the monosodium glutamate, which many of you are aware is being used in cooking, right? It gives you the umami flavor,
Sweet,
but
yeah.
it crosses the blood-brain barrier. That's why it's a neurotoxic agent.
And gives you headaches. Yes.
Yeah, it can give you headaches because it increases the firing of the brain. In fact, it can cause seizures.
Right. Glutamate exactly is your excitatory neurotransmitter.
Yes.
And it turns into GABA, your inhibitory neurotransmitter.
Right.
But if you're giving yourself a whole bunch of MSG, you have all this glutamate that goes to your brain, and all of a sudden you get headaches.
Yeah, exactly.
Right? Especially if you don't have the cofactors as you described. You have to have your magnesium, your B6, so you can make sure you can convert that relatively effectively to the GABA itself, right?
Right.
Yeah.
And of course, the pathway is balanced, right? The brain will produce only as much GABA as is needed by your interneurons. However, it's also very my favorite phrase is context dependent. If you live in a hyper-stimulative environment, the brain will very much try to accommodate as much GABA to produce in order to produce a modulation that will keep you relatively focused or have an attention. But because there's just too much of it, it's overwhelmed, right? It doesn't. Sometimes it cannot cope. More often than not, actually, not just sometimes, it can cope with the exact GABA production that you need in order to cope with a hyperstimulative environment. One of the images that I actually tell parents about this is it's something like this, when we were born before, we would only have like one toy in the crib, and we were able to focus, etc. But now you see all of these,
gadgets, gizmos,
and all the entire crib rim is full of all of these toys and stuff, and the baby doesn't know where to focus, right?
Yes.
Then suddenly you are actually guilty of providing such a hyperstimulative environment to the child, right? And you are already immediately dampening their GABAergic pathway right then and there.
Yeah.
Right?
Yeah. What percentage of the brain's firing neurotransmission is GABAergic?
The central nervous system, 20%. That's a big amount.
It's a huge
right?
amount. Yeah.
It's a big amount for all the traffic in the central nervous system.
Right. And you mentioned also something about interneurons, and this reminded me of a conversation you had with Dr. Carl Friston.
Yes.
And how you were talking to Dr. Friston, who's potential Nobel laureate, somebody that's a neuroscientist, a psychiatrist, a very brilliant guy, free energy principle.
Yeah.
He had some thoughts about GABA and how important it was as these interneurons. Maybe you can describe a little bit about that.
Yes, GABAergic neurons are basically interneurons. So essentially, they are stuck in between, like between a dopamine neuron and a serotonin neuron, right? They're stuck in between this, and there are many of them, right? So they could actually inhibit when it's needed. And the interesting hypothesis, and actually as shown by a lot of studies, is that the pathway by which the brain can get quieted, and this has clinical significance in schizophrenia really, is that if you have extra firing in there, you could probably narrow it down to the central pathway of the GABAergic system, right? If you could inhibit those unnecessary firing, you could probably have a more coherent system in there, which manifests as a more orderly type of thinking. Right?
And interneurons themselves, are they all over the brain, or are they in particular areas of the brain most commonly? Or
interneurons, because they have to inhibit neurons, they are scattered all over the brain, right? But there are particular, so if we are talking about the interneurons, yes, but for GABA receptors do not necessarily have to be in interneurons. There are GABAergic neurons, but there are GABA receptors, which may be in a GABA interneuron, or they can be a receptor that's found in a regular neuron.
Right. What I find interesting about interneurons is there are these pathways between motor and sensory cognition, recognition, understanding, and integration. Right? So you have all these abilities to create memories, to create motor function, to create psychological components of what's going on around you because of the interneurons.
Right. That's why you see a high concentration of them in areas that actually are in the relay centers,
like the thalamus, for
because
example.
they provide a dampening effect or a modulating effect on incoming stimuli.
Right.
And stimuli may be external, right? Something that you're seeing outside. Or it may be internal, like your thoughts that are reverberating inside. Right.
Makes sense. Yeah.
For example, one of the things that they've seen in depressed people recently is there is an increased activity of neurons in the habenular nucleus, right? And, for the longest time, I actually was wondering what else could that nucleus be doing. And then they showed that, in fact, it was more correlated with the angry type of depression, right?
Interesting.
And so, that could be, that has quite a bit of GABAergic interneurons in there and could be really targeted for, you could target the GABA interneurons in there to actually quiet that part of the brain, right?
Yeah, I think for the people listening, it would be helpful just to kind of step back for a second, like GABAtone itself, right? We talked about GABA deficiency syndrome. We're talking about this as a company. We're talking about this more, I think, because people don't know and forget that you have to turn the brakes on and shut things down.
Yeah.
But what happens when GABAtone goes haywire? Like, are there clinical syndromes that are pretty well established that we know that occur, or there are certain types of conditions like depression and anxiety, I think, that are really common and potentially may be related to GABA deficiency?
Yes, but actually, Scott, it is actually easier to look at the effects of GABA with a very common drug that America loves, alcohol.
Yes.
So if you take a look at what alcohol does to the body, you could very well see what GABA does to the body, right?
Right.
So you can see that alcohol is actually a depressant, right? But at the initial part, when you're not yet fully drunk, you will get into a euphoric state. There's a slight euphoria, and then after that, you go down, right? So you could see there on the when you get to be like chatty and in a good mood, etc. That's when your GABA actually is getting balanced because then you're in lighter mood. So you could see the antidepressant effects of GABA, right? Yeah. And then after that, you get sedated, right? There's a sedative effect, and then you go to sleep.
Onto the GABA receptor,
most people complain at night that their thoughts are reverberating, they're ruminating, they couldn't stop. And the one example that I like is that you say you fought with your sister, and you fought with your sister yesterday, and you're fighting with your sister again tonight, and where's actually your sister? It's already gone, right? And you can shut it off. So and the role of GABA is actually to decrease those types of reverberant circuits. Although you could also meditate and say, who am I talking to again?
Is this real? Is this an illusion? Yeah, I understand. I mean, there's also the thought, and I think you and I have discussed this, that one of the reasons why alcoholics drink is because they have a GABA deficiency. So they're trying to drink to increase their GABA levels. That may not be the case when they first start drinking, but certainly as they continue to drink and they deplete GABA.
Yeah, I noticed that in the case of alcoholics, right? Especially the when they're still in the denial phase of the alcoholism, is that what happens is that, oh no, I drink because I'm anxious, right? That may be the initial part when they were drinking to quell the anxiety, but now they get addicted to the alcohol, and now the lack of alcohol causes them anxiety.
Right.
So then that's the addiction. That's when the addiction happens. Right.
Makes sense.
Yeah.
So now that we've kind of given a sense, I mean, certainly there's other conditions that are associated with low GABA tone, anxiety, OCD.
Yes.
Others, maybe you can talk about some of those.
We're talking about two receptors here, right?
I was going to get there. Yeah. That's the next step.
So when you're talking about GABA, there are two major types. There's GABA A and GABA B. You could take a look. You basically just lump GABA B as when you're looking at seizures, then that's it. Right? GABA A is where we talk about anxiety, depression, sleeplessness, and so on. That's lumped into that because it has a sedative hypnotic quality about it.
Right. Let's chat about that. So I think that's the next step. Is like obviously GABA receptors. There's multiple different types.
Yes.
There's two main types.
Yeah.
Let's talk about those. So you just mentioned GABA A. So let's talk more about GABA A receptors.
Yeah, GABA A is this is what you'll hate me for. It's what's called a pentamer. So it has 5 units in it, right?
Right.
But the units actually are of different types.
Right.
So the most common is like 2 alpha 1 units and 2 beta 2 units and 1 gamma 2 unit, right? So that's 5. And when there's an alpha 1 unit in there, that's the one that's more related to sleep, right? So so more related to sleep. And when there's alpha 2 or alpha 3 units in there, then that's more related to anxiety. So it depends. And even the binding in the GABA receptor is different. So there's a binding site for GABA itself, right? So that's called they call that the orthosteric binding site.
Correct. Yeah,
meaning that's where GABA will bind, and that's where molecules that look like GABA, act like GABA will bind, right? And then around it, inside the channel, and across the cell membrane where the receptor is actually placed, are what's called modulators, allosteric modulators. It means that they don't bind to the actual binding site of GABA itself, but they will, when something is bound in there, it will affect the way the GABA receptor works. Like, for example, example of an positive allosteric binding site will be one for alcohol, right?
Of course,
so for ethanol, and of course your benzos, for benzodiazepines, there's what's called a BZD binding site in there, and there are many other binding sites in there that are affected, like neurosteroids and so on, barbiturates, and
quaaludes, of course.
I've not seen those since forever, and I've never tried them.
Not yet.
but what happens then is that they, for example, benzodiazepines acts as a positive allosteric modulator by increasing the binding of GABA itself. So GABA binds in a little bit more tightly, and therefore, affects the chloride channel that opens in the middle. So why does it open the chloride channel? It's called a process called hyperpolarization. So when you excite a neuron, what's called depolarizes, right? So the neuron is normally negative inside and positive outside, and that gradient is actually maintained actively. We have active, sodium pumps pumping out sodium, and so on. And the negative part, of course, is maintained by chloride ions, and of course, a big part of that are also your negatively charged anions, right? Now, so that's the normal way. So how do you put on the brakes? You put on the brakes by making the gradient really, really high, meaning you make the inside really, really negative. So it's very hard for the positive ions to actually go inside the cell and actually depolarize. So even if they go inside the cell, it's still so negative that it won't fire. Right? So other orthosteric modulators will increase the opening and closing frequency of the chloride, right? So, but by themselves, they have no action. Positive allosteric. There are negative allosteric modulations, which have the opposite effect, but we're interested in the positive allosteric modulators, right? Because they actually, in the literature that I've seen, you actually need GABA or an orthosteric ligand of GABA.
Something
right?
like GABA, right?
Yeah, something like GABA.
That binds to the GABA receptor itself.
That binds to the receptor itself and the positive allosteric modulator to work together. However, when I spoke with our guy, the one in Japan, he was a computational Andrew Gallimore,
right? Alien guy.
He actually said, well, it was the first time he was hearing about it, that you actually needed, the actual GABA receptor filled up before these things actually work, and for all intents and purposes, I think that the lecturer from Harvard was correct in saying that you actually need the orthosteric ligand in there in order for the thing to work, right?
Right. So in essence, what happens is that either GABA binds and opens the pore, chloride goes in, or you have a positive allosteric modulator that binds along with GABA and opens up the pore or increases the opening rate of the pore. And as a result of that, the synaptic transmission is prevented. Right? So you have your presynaptic and you have your postsynaptic. And GABA A receptors are typically postsynaptic, correct?
Yes. But the GABA B is both pre and postsynaptic.
Right.
So GABA B has a different mechanism because glutamate is actually released presynaptically.
Right.
So, but it needs calcium to actually release it to the synaptic cleft. So what it does, it inhibits that calcium. It inhibits the calcium from entering the presynaptic part, and therefore the glutamate could not get released, right? And then the other one actually causes the potassium ions inside to leak outside, and so it becomes more negative.
Right, so that's the postsynaptic
part. Yeah, so GABA B is pre and post, but GABA A is only postsynaptic.
I think I'm right to say that the GABA A receptor is ligand-gated ion channel.
Yes,
and then
it's an ion channel. The other one is called metabotropic.
Those are fancy words. But
it's a fancy words.
But all that means is that what happens with metabotropic, it's basically a signaling.
Yeah, it's
cascade,
a signaling system.
Right.
Another system has to be signaled in order to accomplish its work.
Right.
That's a simple way of putting it.
Right. It's GMP, blah, 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 whatever.
Yeah.
So, so we have GABA A receptors. This is where most of the drugs and compounds have been mostly focused on. What are some of the drugs and compounds? You've talked about some of them already. We can stick with the drugs first, like that do modulate the GABA receptor that we know that are used clinically. And then maybe from there, talking about how they work and why they could be potentially dangerous or why they may not be as dangerous.
Most of the sedatives we know actually will be working on the GABA A receptor, the sedative hypnotics, right?
Including the sleep drugs.
The sleep drugs, the Z drugs like zolpidem, for example. That's a positive allosteric modulator, right? We talked about alcohol. We talked about what's this? No, we haven't talked about. There was a drug, for example, that was just withdrawn. It's called gaboxidol, right? And it was being marketed until about 5 years ago or so, and not here in the United States. The one I found was I don't know whether it's being still marketed in Mexico, but it's actually looks like, feels like, walks like, talks like GABA. Right. And of course, the party drug, GHB, right? So they can be potentially dangerous because when you inhibit that, they can be, of course, loss of consciousness. And if you're doing something, right, you can lose consciousness. Of course, the mechanism of GHB, there's a reason why it's called the date rape drug, right? It's because you lose consciousness in it. But I actually have a beef with that because although I've never taken GHB, those who have told me have taken it. It's actually quite too salty. If you don't notice that in your alcoholic drink when you're drinking, that has been poured in and your drink is really salty, you must really already be drunk.
Unless it's a margarita, maybe. I don't know. You got the salt on the end. I used to do this when I was younger, or the tequila and the shots with the lemon, or the lime. No, but you're right. That's interesting that it's salty as well. I didn't know that.
It's very salty.
And there's one interesting compound, and we don't have to go into the mechanism too much, I don't think, but it's called an inverse agonist.
Yes.
For the GABA A receptor that might be interesting for people to hear about.
Inverse agonism is actually a more complex concept to know, but the main issue in there is what happens is that when you actually try to stimulate the GABA receptors, right? There will be a certain percentage of the GABA receptors that are in the correct conformation that will actually produce the desired result, like sedation or sleep or, whatever you want the calming portion of it to do.
Right.
And then, however, the body is always in a balance. Even the receptors are in a balance. It will create exactly some receptors for it to balance those that will have a conformation that will actually oppose that effect. And I know why you're asking me this question because an example of inverse agonist is the one that's found in Banisteriopsis caapi, which is beta-carbolins, right? And Banisteriopsis caapi is the vine in ayahuasca. Right. So
this is why you don't get sleepy with ayahuasca.
Beta-carbolins in ayahuasca in the vine itself is actually an inverse agonist of GABA.
Along with being an MOI.
Being an
inhibitor. Right.
MOI.
So we have the
MOI B.
MEO.
Oh, is it B or A? I think A.
I think it's A as well. Yeah. So you have agonists, you have reverse agonists, you have antagonists. These are just words that mean you either increase the firing, decrease the firing, or decrease the firing in a very strange way with the conformation.
Yeah.
And there are some specific GABA B drugs as well. And these are mostly, I think, what's the most common one that we know of?
Baclofen.
Right.
Baclofen. It's for seizures, right?
Right.
When you want these are very fast muscle relaxants, right? But in a twist of fate, the GABA B drugs can also induce seizures.
Yes.
So as a cruel joke, I said, can we induce increased firing in the brain of catatonic people by giving them baclofen? So,
I wonder if it's been studied. I mean, back in the 1940s when they were giving lobotomies to everybody, you think they might have given?
I don't know whether we could still do that today.
Baclofen's an old drug. I don't know. They might have been using it.
It's
used in spasticity a lot because it also used. I'm pretty sure it also works pretty peripherally. So in the peripheral nervous system, you have a lot more GABA B receptors.
Yeah.
And I know you talked about GABA A and the various subunits being different depending on the type of stimuli they get. Is it anxiety? Is it depression? Is it sedation?
And they're also distributed in different parts of the brain at different ratios, right?
Yeah. Do we have a sense of that as far as where things are, or is it more focused in particular areas, or do we have?
Yes, as I hinted to earlier, they are actually concentrated in areas where, for example, the interface between the one that's doing the processing between the external and internal, like the thalamus, for example, or where there is, there's an increased production of dopamine, for example, like substantia nigra and all of those areas, right? So striatal areas, where you could see all when you could see the neurons, there's lots of serotonin getting produced, there's lots of dopamine because they're also concentrated in different parts of the brain, right?
Right.
If you see those, you can bet your money that there will be a concentration of GABA interneurons in there because they are responsible for modulating even that production, right?
Right. And so they're going to be the off switch. They're going to be the dimming switch.
Yes, the dimming switches.
Right.
Yes.
And the dimming switch, so that with all that firing that's happening with dopamine and serotonin, you have something to break those cycles.
To break the cycles,
and to also create some sort of sensory funnel or sensory or some
sensory
way of
gating.
Gating, that's the word
sensory
I'm looking
gating.
for. So you have a gate so that you don't get everything through.
Yes.
This is interesting with some of the other models that we've been talking about with consciousness, for example, and how we understand consciousness as are we getting sensory information from the outside world, or are we just creating a model in our head already, and where things go? So GABA must be involved in that.
Right. We know the thalamus is a big sensory gate, right? It will cut off signals. Already, the brain is creating models all the time. And, with my conversation with Carl Frisson, and the lectures is given, it's like we have a generative model in there. It's Bayesian, right? It's based on your priors, and then it builds a model, and then it minimizes the error. Right? It minimizes the error of your prediction. And the simple way to understand this is, for example, if you're say you're learning to catch a ball, say baseball, right? And your hand is making adjustments all the time, and the brain is making models all the time, and you're not aware of it, such that you're actually able to anticipate with the current conditions. You're just feeling the wind, you're just feeling, you're just anticipating the pitcher. Say you also have prior knowledge of how the pitcher pitches, etc., etc. You can actually anticipate where you're going to catch the ball. It is not, the interesting thing is generative, meaning it's basically generating it all the time. It's not it's not pulling it from the past, but rather generating it all the time. It pulls in memory, of course,
right.
But it's actually generated right then and there. And that's a huge part of, what we're seeing is actually a simulation, right? And many, when the statement "we live in a simulation" is put out there, most people misunderstand it. And from a neuroscientific way of understanding it is, Anil Seth famously said, we're all hallucinating all the time, because everything that we see is just really a creation of our brain and the way we sense things, right? We don't, like, for example, if you see a blue pen, pen is a word, right? And it's just an utterance in your mouth, right? It's just a sound, really. And you don't really know what the color blue is. You never know what it is. You just are making it up. So in that sense, it's like you don't really know what it is, right? It's made up of what? Atoms. It's made up of quarks, leptons, if it's like a quantum wave theory, then it's made up of quantum waves. So you never really know the true nature of that. But so everything is just being quote unquote simulated for you. And to correlate it with Donald Hoffman, he says that what is being simulated actually is very goal oriented. So it's it's related to what's called fitness function. So you will see something actually differently, right, when you're hungry as when you're not hungry. So when you're buying groceries, when you're hungry, you'll buy more. And
not a good idea. Yeah.
So you see that all of these are related to this particular issue that we're talking about. And but you will also see the importance of the fact that the GABA is actually a modulator, a modulator of the simulations being created, right? So because one of the things that is placed into simulation, which the likes of Jeff, forget his last name, Hawkins, was saying, is that we don't need to put emotions into the intelligence model for in AI, for example, but other people disagree because emotions put you in a particular state. But for me, the way I see it is that emotions are actually part of evolution, right? Initially, if you could see our respiratory functions, etc., are all at the base of brain, the brain stem, etc. All of the regulation of breath is there, and then of course emotion. So it's either a fight or flight response, or fight, flee, or freeze response, right? And then after that, we develop a cortical system. So now you could see that not only is the brain pulling the current simulation from memory, it's also pulling it from emotions. So the story that you tell yourself, right, is actually when emotion is there. So you could see it's like the story tells us it's like the lyrics of a song, right? Its same chord can be played in different ways, with different stories. So you could see that the same emotions, there are only a few basic emotions that are out there, but you could see them getting played. Now, if GABA is there are certain emotions that it tends to inhibit a lot more, right? So essentially, it will put you more into a parasympathetic mental space and a parasympathetic nervous space.
Right. Yeah.
Right? As I was hinting earlier, when I actually have a patient right now who is very young. There's nothing wrong with him, but has performance anxiety when it comes to the bedroom. And so we have a product, Trocalm, which has which has a couple of elements in it. One is an orthosteric ligand of GABA, which is actually GABA itself, right? It's nicotinyl GABA. As you know, the blood-brain barrier is impermeable to GABA, right? If you take GABA, it doesn't really cross the blood-brain barrier.
Right. GABA by itself as a supplement doesn't work very well.
Yeah,
right.
it's big because it's a big molecule.
It's a big molecule.
Yeah. So what you do is you link it with vitamin B3 or niacin, right? And so that's called nicotinyl GABA now. And GABA is just a payload. Vitamin B3 crosses the brain, and when it crosses the brain, it hydrolyzes into vitamin B3 and GABA. So now you have GABA in there, and
the benefits of B3 as well. Right?
Yeah,
at low doses. Yeah,
and then at the so that's the actual orthosteric ligand. So what I did there was I put kava and kavain, and kavalactones are actually positive allosteric modulators.
So the kavain is the very active portion
of kava.
Right.
Pipermethysticum.
Yes, to be correct scientifically.
And so you're attacking both, and so suddenly you have this natural product that actually mimics the receptors of the more famous drugs out there that play out on the same receptors. So what happened to this guy is that he takes 1/4 of it, and suddenly the performance anxiety drops, and voila. Of course I had to investigate all the other things why there was no performance anxiety, but I couldn't find any. And as you know, guys, performance anxiety is usually a mental thing, right?
It's stressful.
Is an anxiety.
It's anxiety.
Right? So GABA would quell that anxiety, right?
Yeah. So you kind of exactly where I wanted to go next was understanding that taking GABA, there's natural equivalents to either GABA itself or the allosteric modulators that you mentioned before, but certainly taking GABA itself doesn't typically work. I've had certain people come to me and ask, well, I take GABA at really, really high doses and it seems to make me tired, and there might be a possibility of very, very high doses, but certainly at the doses that you find in most of the supplements, it's not working at all. And so there's a number of sort of natural GABA agonists that we talk about. You spoke about 2 so far. We talked about nicotinyl GABA, which is the vitamin B3 attached to GABA. Spoke about kava or kavain, or the kavalactones that are the active components of the kava plant. Are there any more that interest you that have been on your mind, thinking about other products and other places we can put these things?
Actually, one of the things that has fascinated me are the Z drugs. Right? The Z drugs like Solpidem and all of those.
It's like, the Ambien, Lunesta.
Yes. Like, how do they make you sleepy? You know, and you find out, they are actually positive allosteric modulators of the GABA A receptor rather. And I said, well, what are the natural products that will make you sleepy? Well, honocayl, that's from Magnolia officinalis bark, right? There is also reduction of the of honocayl to dihydrohonocayl, which is also a modulator, right, of the GABA A receptor. So you have valerian root,
right?
I think it's Valeriana officinalis, right?
Or valerianic acid.
Valerianic acid,
yes.
So
that's the active.
one time I was at the airport and the dog was sniffing my my luggage, and I had to open my luggage and zeroed in on, because the valerian root was not in a bottle. I put it in a plastic bag because the bottle was so big. And the dog went straight for it because it really smelled like shit.
Yeah, it's not the most wonderful smelling product out there.
But having it extracted is very expensive, as you know. Valerian root is one of those that you have to take at 600 milligrams, for it to take effect. But it's very good for sleep induction, really. But the use of positive allosteric modulators for me comes from an assumption that you do have some GABA that's being produced. Right.
And this is important, right? Because we talk about this with our nonprofit, the one that you pioneered, that we'll work together here. We called Health Optimization Medicine in Practice, because the idea here is that you just don't give things without having an understanding of what's happening underneath the hood. Like you talk about this. How would you describe that to people listening?
The way we do it in health optimization medicine is actually when we balance, we detect and correct imbalances. We don't diagnose and treat disease, right? So if we go to the way we balance things, first we balance them with what I call the bioidenticals and bioactives. So if you want to give GABA, then give something, a GABA that crosses the blood-brain barrier, right? You know, it's very hard, by the way, to raise glutamine, because glutamine is the primary fuel of your intestinal cells. Your intestinal cells will eat them up first before anything gets to your brain.
Yeah, people don't realize that.
Yeah, right. So, and of course, you don't want the patient or yourself or your client to be irritable, because this is a side effect of taking too much glutamine, crosses blood-brain barrier. You know, you get irritable. So you said it's coming from amino acids, right? So the bioidenticals and bioactives are exactly that. So you have to give vitamin B6, for example. You have to give magnesium, because these are actually necessary for the production of your GABA. And then and then the second line would be your what I call the phytoceuticals, fungiceuticals, and bacteriophages, right? And that's where we have magnolia bark, valerian root,
kava.
Kava, all of these things are actually helpful with that. And then I think I showed you, one picture where even cannabinoids had a receptor as a positive allosteric modulator of GABA.
Right. So CBD is
CBD.
And some people THC can be a negative one.
Negative.
So that's why it can cause some people anxiety.
Yeah.
Is that THC can cause this this disinhibition of the GABA receptor, so you have more firing as a result of that. The cannabinoids for sure.
The CBD is actually a positive shown to be a positive allosteric modulator. Right, so that's why it calms you down.
Right.
And then below this phytoceuticals, then we proceed to the drugs. And the reason I put drugs last, even if we're both physicians, is that most drugs have never been seen by the body in evolution, right? So if there's but if it's been produced by plants or being produced by animals, etc., and being eaten, so somewhere, sometime in the past, we have already eaten this,
right?
Some may have died from it,
but they learned, or their families learned. Their families learned.
So it's actually easier to put the drugs last, because they actually are very, very effective, right? But they just go straight for the jugular. They wouldn't consider how balanced or imbalanced you are.
Right.
They wouldn't check your glutamine levels. They wouldn't check. It's just
no B6 levels, no magnesium levels.
Nothing.
Yeah. One story I love that you've told me a while back with how you started this practice. You were doing health optimization medicine and practice, as it's called now, for over a decade in Manila, and you had a really hard time in the beginning because people would stop all your supplements.
Yes.
And you asked about supplements versus drugs and evolution. You want to tell that story?
Yes. I have been called a few times, and the doctors at the other end of the line would say, what is it basically, hey, Achacoso, what's your vitamin supplements, cofactors and hormones going to do to my drug treatment? And I said, actually, you have the question in reverse. Your drug has never been seen by the human body in evolution, but my vitamins, cofactors, and minerals, have already been seen by the body in evolution, and in fact is being used by the body to heal itself and to survive. And I said, so you tell me how your drug is going to affect the levels of my vitamins, minerals, cofactors, in the light of your...
There might have been an expletive or two thrown
yes.
in there.
Yes. Initially it was like if it's like a personal exchange, it's like this incredulous look from them that I'm actually questioning their drug therapy. But when you look at it, how is the body going to metabolize this drug that is never seen before? Right?
Yeah, I know. And now most of those people, the ones that were yelling you 10 years ago, the ones that your patients are, they're your patients now.
You like the story? It's like, because when I began practice, I really made some, basically, probably a very big wave, such that, though I basically infuriated quite a few physicians who belong to certain powerful societies, right? And then 10 years later, they've grown older.
Yes.
they come with their apologies, and it's like, please, we're sorry now. Can you please do your anti-aging magic on us?
So it all comes back around. This has been the story of your life, you know, with everything from AI to anti-aging medicine to everything else, and even the things that we're doing at Troscriptions and other stuff now.
Yeah, but it's good that we're making a dent, right? And I'm really happy that you joined me here when you were looking for a framework to actually do this, right?
Yeah, I mean, what you said to me, I think, when I first met you was that we're looking to move the needle on health just a little bit.
Yeah.
If we can just do that, I mean, how much more can people survive and thrive and enjoy their fitness function, as Donald Hoffman said?
Yeah. And look, now we have homehope.org, our nonprofit that actually teaches other doctors and non-physician healthcare practitioners on how to optimize health. You know, not to treat disease. You know, as I like to say, you know, disease is managed, health is optimized. You know, these are two different things that you do.
Yeah. And that was the framework that really resonated with me. Is because if you can set disease aside and just focus on the basic cell, optimizing vitamins, minerals, nutrients, the gut, you know, neurotransmitters, hormones, and have a framework to do that in a very simple way that you can wrap your head around. I mean, we're training doctors and practitioners now, and we're pretty early, but we're starting with our cohorts, and you can go to homehope.org if anybody's interested in learning more about those too.
Yeah. Well, as you know, guys, I have branded Scott to be the world's expert in hyperbaric oxygen therapy, and he is. He's actually excellent. And when he said, he asked me, when we met for the first time, he asked me, what am I really doing here? I said, you're doing nothing but simple redox balance. And he was taken aback and said, oh my God, that's true. You know, it's like, oh, this is what I'm actually doing. And, you know, he became a fervent believer from there on that, you know, the body's balancing things all the time. Right.
And this is what metabolomics is all about. This is the first module of the essential certification for health optimization medicine and practice. It's the basics of everything that we understand now and we can measure, which is metabolomics.
Yes. You know, we define health as the absence of disease plus the balance between the anabolic and catabolic processes according to the life cycle, right? A plus B plus C. And that balance is actually the dynamic homeostasis. And if you equate that to spiritual terms, that's called equanimity.
I've heard of it.
So your body also seeks physical equanimity. So
So dynamic homeostasis.
Dynamic homeostasis, yes.
Or dynamic equanimity, as we like to say at Troscriptions. And then that's really what we're all about at Troscriptions. That's really what we're all about at Home Hope. And that's what, you know, your life is all about, right?
Yes.
I mean, at this point.
And I think it's actually I'm encouraging people who are starting companies to actually also start with a balanced companies, right? One would be what I call, it's a yin-yang model. One would be the yang, that will be the for-profit company, and one would be the yin, that would be the nurturing company, right? Like for us, Home Hope is our educational company.
Our nonprofit, right?
Yeah, a nonprofit. So we actually support it by donating to the nonprofit in a committed way. We don't say, oh, we'll make profit now and donate to something later. It's like, even when you're not making money, you're already donating, not just money, right? The service, the time, and everything else to do it. It's like you're already giving back as you're earning money. And, you know, and for us, it's the secret of our success, you know, because what for are you earning these billions and billions of dollars if you're really continuing to destroy the oceans, pollute the earth, you know, pollute the atmosphere and so on? It's like, what are we really doing here? Are we really just going to survive and reproduce and do nothing else, right? So, but in the meantime, why can we not make the quality of our lives a lot better? You know, you know, even if I'm considered a longevity doctor, I'm consider myself as actually a more of a quality of life doctor, right? So, you know, for me, it's like, what's important is what is right now is the quality of your life, right? And you know, mental pain, right? You know, when your mind can't stop churning, right? You know, I'm a little bit, although my mother cursed me for being impatient, but you know, my life has been about patience all the time. I have patients in the clinic. I have students that I have to be patient with. I have businesses that I have to be patient with, right?
Your girlfriends, you call them your girlfriends.
My girlfriends, right? You have to be patient with all.
One of them's
things.
Patience. One of them's prudence.
Yeah, I have 3 P's. No, I have patience, prudence, and temperance.
Temperance, okay. Those are your 3 girlfriends.
Those are my 3 girlfriends. Patience, prudence, and temperance make for 3 girlfriends. And if you're lucky, you can actually have 3 more girlfriends: faith, hope, and charity.
Beautiful.
Yeah, or in Spanish, fe, esperanza, caridad. Right? So
and more GABA.
And more
to get back there.
And to be patient,
Yes.
guys, it's true. And this is true. To be patient, you really need a little bit more GABA.
Right.
And not too much, because that will make you so conservative that you will hoard all of your money to yourself.
It's always a balance.
It's always a balance.
Yeah,
right?
and going forward, our company is really going to be looking at this system in a much more significant way for additional products, right?
I was very much inspired by what Carl Friston said, because really, for example, although we're not working on schizophrenia, right? For me, it's more like, how can I quiet the mind? Or how can I be Zen-like by just popping a pill? Or by just inserting a trochee up my buccal cavity? And how can it achieve Zen-like quality, instantly? And if you could make people realize that the mind or the brain can be quiet.
Just give them a break.
Yeah, give them a break. Why not, right?
Right.
Because a lot of these things... so when he said that it could be the central molecule, that it's probably the central molecule where all of this disjointed mental activity is actually united by that molecule in schizophrenia, us really it's a very hard nut to crack. Right, that particular problem it's multiple etiologies and so on. But since at Home Hope we are taking care of the fundamental cell, right? So we're looking at what are the signaling molecules that actually are affecting this. And one of the things that has emerged in our hyper-stimulative world, right, in the era of social media, etc. Your dopaminergic likes. Whenever you see someone like you, oh my God, my dopamine rises and rises and rises.
Or checking your phone every 8 minutes.
What has been missing now is that we need to shut this all off, right? And in fact, although the term has been bandied about as a dopamine fast, I actually would more propose the term GABAergic feast. Right?
I love that. Yeah.
GABAergic feast would be during the time that you're fasting from dopamine and all other stimuli. You're actually raising your GABA system. And the next time you face someone you don't like, in particular, your response to it would not be so visceral as you would.
Right. And we know that meditation, of course, increases GABA.
Yeah,
yoga
absolutely.
and certain types of exercise will increase GABA as well.
Yeah.
So I like the GABA feast rather than dopamine starvation. Nobody likes to starve. Everybody likes to feast.
Right. Like that's the way I also phrase, intermittent fasting. No. I phrase it as feeding window, because fasting sounds so deprivatory, right?
Maybe it should be feasting window. I don't know. Maybe that's too much. That's too much for people that need to lose weight, maybe. But I like that too, right? The idea is we have to spin it out into the positive and do our best to say, look, this is a GABA feast. You're going to enjoy this. Right? Yeah. Well, I think this has been a great time, Ted. Thanks for taking your time after this large conference and speaking to people for 3 days straight and being, the guru in the back, making sure everything works.
No, Scott, I am just really at the back. As you know, guys, he has taken my GABA lectures and actually made it a lot better. So
I'm just trying to dumb it down so I can understand, guys. That's what it comes down to.
No. So if you have any questions, ask me.
I knew you were going to say that. All right. So if anybody's listening, you guys can head over to Troscriptions.com. We have TroCalm there, which is our calm relaxation formula, quieting the mind because it increases GABA tone through nicotinol GABA, kava, and then CBD and CBG, which are non-psychoactive cannabinoids, but also affecting not only the cannabinoid or the endocannabinoid system, but also the GABA system as well. And more products to come, of course, affecting the GABA system, something with sleep pretty soon, probably, and others. And we're really excited for that, and some new molecules that nobody's ever seen before, which, well, maybe in other ways, but not in a long time. And of course,
new molecules that no one has ever seen placed in any GABAergic delivery system before. There you go.
Beautifully said. And then if you have any information, if you have any questions or you want to go to check out our nonprofit, you can go to homehope.org. And there is a free module for everybody to sign up for to learn more about the course. There's a free lecture by Dr. Ted that's on there that he gave at Stanford with one of our colleagues. And we wish you the best of luck checking it out. And it's been awesome. Ted, any final words for anybody?
Just make sure that when you wake up in the morning, you just take 3 deep breaths first before hydrating yourself. That actually already puts you in a more GABAergic mode for the day, right? Because everything, your emails and everything else can wait. So unlike Scott here, where I have to hide his phone so he doesn't pick it the first thing in the morning, you can actually deposit your phone elsewhere and begin with a more equanimous day, right? The way you break your day will usually determine how your day will go. So if you wake up gently, keep that that GABAergic system, GABAergic state, stay with you a little bit longer, right? Then you probably have a more equanimous day, which is really what we're after, the quality of our life.
Thanks, Ed. This has been fun. Thanks so much for listening to this episode of the Smarter Not Harder podcast with Dr. Ted Achacoso. We hope you really enjoyed it. Please like and subscribe so you don't miss an episode. And head on to Troscriptions.com if you're interested in our products, or homehelp.org to take a look at our essential certification in health optimization, medicine, and practice. See you next time.